Introduce our speakers and our program for today.
All right, Gary. Our program today addresses the fourth area of focus for Rotary International, and that is of saving mothers and children. But as you see, it also includes fathers because it's really about households. The presentation is based on household data in Whatcom County produced by an annual survey. It will be eye-opening for most of us. Patty Boyce is the Workplace Development and Community Impact Director for United Way. Patty has been a member of the United Way team for the past 10 years. As a donor and prior volunteer community member on the Fund Allocation Committee, she's been involved with both raising and allocating funds, as she does now in her current role, serving development and community impact. Her co-presenter is Kristi Birkeland, and she is the Development and Communications Director for United Way. Kristi has been involved with the United Way as a donor, volunteer, and employee for over 15 years. She began her journey as a volunteer while working at a local insurance company. She then began volunteering for the United Way as part of the Fund Allocations Committee and was hooked. Her current role involves marketing, communications, and development. Kristi and Patty, welcome to the Rotary Club of Bellingham. Kristi, you have the floor and please share your screen.
Thank you so much for having us. I'm going to ask my colleague Patty to share her screen since she is all ready with that information pulled up. We are going to tag team a little bit. Of course, we want this to be interactive and informational. We want to thank you again for having us. I see some familiar faces in the room for sure, including Peter Tyson. So
Kristi,
nice to
I
see
think
you
we have some feedback.
Oh, all right. Let me see if I can switch speakers. Thanks. How about that?
I think that's better. Go ahead.
Well,
No, it's not.
I'm gonna head out then. It could be me. Let me put my, we're next door to one another.
Oh, yeah, just one of you mute. That should be fine.
Go ahead, Kristi. Kristi, go ahead.
Perhaps while we're waiting for Kristi to come back, I could show the video. It's about 3 minutes. And if she comes back early, I'll go ahead and stop it, but at least we'll have something to watch while we're waiting for her to come back.
My name is Brett.
Cool. And what do you enjoy doing at Max Higbee Center?
I enjoy doing the martial arts.
So that's your favorite activity?
I'd have to say that's the one I really like doing the most.
Yeah.
I like hanging out with Hillary and Megan and Beth, and I also like hanging out with Jimmy. Jimmy's a good guy. Jimmy's really into Marvel. He loves the Avengers and he loves everything that has to do with Marvel, and he also loves Batman and Spider-Man, and I like hanging out with Hillary and Megan and Beth and a lot of the other people I've known. Some I've known since middle school, others I've known earlier than that.
Yeah.
I used to go to the Max Higbee Center when it was over at the senior center.
So, like, how long ago was the first time you went to Max Higbee Center?
Oh, that was probably like 21.
So, how old are you now?
I'm gonna be 42 on the 19th of June.
So, 21 years?
It's been about 21 years, yeah. Max Higbee Center is a place where people with disabilities can go and hang out and not have to worry about being ridiculed for being different. it's a program that's really important, especially because a lot of these people don't really get out very often. So for them, this is kind of a way for them to kind of get social interaction with other people who are disabled.
What are you holding in your hand?
This was made for me tonight by my good friend Beth Margolis. It says, I remember Brett. I remember meeting Brett. You are an awesome guy, from your friend Beth. To anybody who might be interested in coming, or interested in volunteering, or just interested in having anything to do with the Max Higby Center, I would encourage them to do it because it is a good program and it does mean an awful lot to a lot of the people that come here.
All of these people.
All these people are.
All right. Hopefully we've got our group back up.
Hopefully, testing.
Oh, that
Yep,
sounds much
that's
better.
good.
Fantastic.
It's not a meeting in 2020 if there's not a technology problem. It's just, that's our experience. So hopefully you can hear me. Hopefully you can see the screen. Are we good? Okay, thumbs up. Well, we will keep it brief. I just want to acknowledge there are so many amazing nonprofits in our community. We love the Max Higby Center, so fantastic. But we are United Way of Whatcom County, and we have been around for a long time, and we're doing some pretty amazing work, and you're helping us do it, so thanks. If you want to go to the next slide there, Patty, we'll chat a little bit about numbers. A few numbers to consider that we brought with us. I don't see them popping up, so I'll just go ahead and keep talking.
Yeah, I'm trying. Thank you.
It's all good. It's all good. So I just brought we like to start with a few numbers, and some of the numbers we talk about are program numbers and statistics. Patty's going to give you a lot of information.
Kristi, hang on. Kristi, hang on just a second. Shauna, can you advance the slides?
I'd be happy to do that if you'd like me to advance the slides. Are you guys got it?
We're there. I see it.
Okay.
Again, my apologies. Presentations have gone much more smoothly in other online venues, but here we go. We're plugging through. So a few numbers to consider. You can see on the screen here, that number 36 represents the number of Whatcom County households who are having trouble making ends meet. And that number comes to you from the United Way Alice report, and Patty's going to go into much more detail about that in a few slides. But that's just a good opening, is to recognize that about 1 in 3 households in Whatcom County does not earn enough to afford the basic necessities of what it costs to live here. If you scoot over to the next photo, you'll see a local 3rd grader. His name's Damien. We spent some time with Damien's mom this year and did a little video about him. He's also a program recipient. But the number 22 represents the number of local nonprofits that we support with the funding that we raise every year. So that's 22 organizations doing all kinds of things for moms, kids, families in Whatcom County to help them become financially stable. So as a staff, we all give to United Way, we all believe in the model, and I get really excited because one gift to United Way spreads out really far to 22 different nonprofits. If you hop over to the right, you'll see the number 50,000, and that refers to the number of Whatcom County residents who benefit from a United Way funded program every year in Whatcom County. It's a lot of people making a big difference. And the number to the right of that, with our friends at the Sun House and their Live United masks, that 150,000 represents, in fact, it's different now. I need to update the slide. It should say about 175,000, and that represents the amount of dollars we've been able to give out through our COVID fund. So back in March, we started an emergency recovery fund for COVID-19, and we have been able to give out about 175,000 to help nonprofits deal with increasing demands, transition their services to meet social distancing requirements, and really just adapt and adjust to these crazy circumstances we have this year. And that includes a gift to the Salvation Army. So it was nice to see their faces this morning too. We can move on to the next slide and chat just a bit about our focus area, and then we can go into greater details about why we focus on that population. I mentioned the Alice report and the 36% of our community that has trouble making ends meet. So our focus area is supporting individuals and families who struggle financially. And the Alice report provides a lot of data and information about these families. And so what we know is that in Whatcom County, there are a percentage of people who live at the federal poverty level or below. And then there's a percentage of people who are making above the federal poverty line, but not enough to make ends meet. And so that chunk up there is what we call the Alice population. And again, they're working, they may have multiple jobs, they just are not making enough to afford the basic necessities in Whatcom County. So food, transportation, healthcare, technology, and all of just the basics. So what we do is we fund that group of programs working to provide basic needs. So we know that if people don't have their basic needs met, they have a hard time taking the next steps towards financial stability. So we need to make sure that people have housing. We need to make sure that people have enough food. We need to make sure that people can feed their families and be housed in a safe way and have the care that they need to get those basic needs met. And then once they're stable, in that way, they can consider moving on towards economic mobility. And those programs in the economic mobility category, which we want to help people be more able to make more income and get their needs met. So we provide funding to programs doing vocational training, literacy training. We want to make sure that people have the tools that they need to manage their finances and understand how money works. A lot of people don't even have bank accounts. So there are just all kinds of programs to help people take those next steps. And then our ultimate goal is to help break the cycle of poverty in our community. So too often we hear from our partner agencies that they see generations of families coming through the door for help. And what we want to do is make sure that we're providing or we're helping fund programs that can really wrap around families, moms, kids, and make sure that they have all that they need to break the cycles that are holding them back, keeping them from reaching their potential. So things like early learning programs, quality childcare, help for education for at-risk students, things that really provide those stepping stones to breaking out of the cycle of poverty and moving forward in their lives. So we really take a large scale approach to solving problems in Whatcom County. And if you go to the next slide, you can see how large. So this is a current list of our partner agencies, and these do change from year to year, depending on what needs arise in our communities, what's happening in our communities, who applies for funding, and of course, how much money we're able to raise every year, how much we can give out. So this is our current list. It may change here and there from year to year. But yeah, it's a lot of agencies and a wide breadth of services. You want to move forward to the next slide? We'll just talk a little bit more about Alice. And like I said, Patty's our data person. She is excellent at explaining, getting down to the nitty gritty, and we're going to do that. But just to recap, so ALICE is an acronym. It stands for Asset Limited, Income Constrained, and Employed. So these are folks who are working, again, but just aren't able to afford the cost of living. And the nice thing about the ALICE research is it does go specific into different communities and calculate the cost of living in Whatcom County. And then what does it really cost to survive here, and what are people making, and how do those numbers flesh out? So if we want to just kind of move forward, I know we got a little bit of a late start, so I'm going to pass it off to Patty to talk about some of the specifics of that report, give you some detailed information.
Yeah, thank you. Can you hear me okay?
Mm-hmm.
Okay, great. I'm going to leave my video off just to try to go through these slides quickly and not encounter any other issues. So as Kristi said, ALICE refers to this acronym, Asset Limited, Income Constrained, Employed, but we're really talking about households in Whatcom County that are having a hard time making ends meet. So they're above the federal poverty level, but below what we refer to as the household survival budget. And we'll take a look at that budget on the next slide. But it's really a culmination of what it costs to afford the most basic needs in a household. So things like housing, childcare, transportation, taxes, healthcare, technology, so cell phones and internet. The ALICE threshold is the average income that you need to afford those household survival budgets. And of course, that differs depending on your household type, whether you're single or a family. If you are living below that ALICE threshold, then we're talking about ALICE families in addition to the households that are at or below that federal poverty level. Typically, Alice families are multiple wage earners, people working hard, maybe working at low income jobs or low wage jobs. And we know from the Alice data that that includes folks that are cashiers, healthcare workers, folks that are really helping drive our community and support different parts of our community, doing very important work, but earning a low wage. And they also typically don't have savings to guard against unforeseen emergencies, nor do they have that savings to invest in the future. So post-secondary opportunities for children, home ownership, retirement, as the slide says. So we'll take a closer look at that actual monthly budget. And this is specifically for Whatcom County. And if you do go online and see the full report, you can break it down by county. In Whatcom County, you can also see the state average. But for here in Whatcom County, this is what we're looking at based on 2018 data. And what you can see from these three rainbow lines here are three examples of a household budget. So for an individual, for a senior, and then furthest to the right is a household survival budget. So that includes 2 adults and 2 preschool aged children. The other thing you'll see on this chart is the 2 gray bars that represent the federal poverty level for an individual and for a family of 4. And so the idea is that the cost of living has increased and has outpaced the increase in wages, not just in Whatcom County, but throughout the region. And we see and we know that some folks who are at or below the federal poverty level have access to some support, but that's really not a good representation of who is struggling in our community, because there are so many more families that are earning a bit more, maybe even twice as much, but are still having a hard time making ends meet. So you can also look at these different color categories and get a sense of what is the most expensive part of a family's budget. And if you look to the far right, you can see that for family with 2 preschool age children, that's childcare. And we know that's the case for our community and for many other communities, that childcare is the most expensive cost for so many families with young children. The other thing that you might notice about this chart and the data is the fact that these are very modest dollars we're talking about. So for a household of 4, you can see that they've included for the Alice report housing cost of about $1,000 or just over $1,000. Well, if you can find a place for $1,000 in Whatcom County, that's a rental for 4 people, that's good on you, because it's tough to find that. So these are, again, very modest expenses. The budget is made of not, talking about mortgages. It's very modest costs of modest needs in those categories. So if we dig a little deeper into the data, this is specifically, again, Whatcom County. If you look on the left, you'll see a line chart, and this represents the number of households by income in Whatcom County. And then on the bottom right, we're looking at the percentage of households by income in Whatcom County. And the reason that I included both is because you can see a bit more detail with the line graph. And what we see is that really over time, not only has our population increased, but we've seen these kind of ebbs and flows. That top line represents Alice households, and the bottom line on the left-hand chart there represents folks who are at or below the poverty level. But the takeaway from this slide is that we have a big chunk of our community that's struggling to make ends meet. So if you look down at the percentage, as Kristi mentioned, 36% of families in 2018 are below that Alice threshold. So they are struggling to make ends meet. And this is something that our work and the work of our partner agencies hopes to counter. If we look a little more in detail, we want to see what types of households are struggling in our community. Again, this is Whatcom County data. We see that Alice and poverty level households are represented across all living arrangements. So not just single and or cohabitating households, but families with children, and then folks who are 65 and over as well. And then if we drill down into that families with children component, we see that not only do children add, as most folks know, a significant expense to a family budget because of things like childcare and additional mouths to feed and all those things, but we know too that folks who are single-headed households, both single female-headed and single male-headed, are really taking on a larger burden because they are one income family and they are still paying for the bills of their children and for themselves. So it's astounding to look at this in particular for single female-headed households. We see that more than 75% of those households are below the Alice threshold. If we look at that data by age here in Whatcom County, We see a bit of a difference, but again, we do see that there are households in poverty and ALICE households that are represented in all of those age groups. We do see a bit of a, and this is unique to Whatcom County, an increase in families or folks under 25 who are in poverty. Part of that could be because we are a college town, so there are a fair number of young folks here. Part of that is because those folks are likely working side gigs and low income jobs if they're able to obtain jobs. The other thing that you'll notice is that if you're older, you're more likely to be in ALICE households. And then when we look at households by race and ethnicity, again, we see that this is a swath of what we see in our community here in Whatcom County, but also in Washington. There are folks who are disproportionately impacted and have been for many reasons, but they face some economic and systemic barriers that have limited their earnings. And we see that in this data. So it's a disproportionate number of folks who are non-white households that are poverty and that are ALICE households. So we just got a couple more slides here, and I'll try to work through these clearly but quickly. So this is one of those reasons, and I think we both, Kristi and I, highlighted this towards the beginning. You know, we have seen the cost of living outpace wages, and this is a chart of of the state of Washington from 2007 through 2018. And you can see that there has been an increase in the number of low wage jobs, while we have seen mostly static or no growth in high wage jobs and a fluctuation both up and down among medium wage jobs. And so that means that, like I said, folks that are working are having a hard time making ends meet. They might be a dual income family, but if they are earning less than $20 an hour, it's going to be tough to afford the basics and the basic necessities. And we do know that more of half of the jobs in Whatcom County in 2018 were paid hourly. More than 40% of those jobs were paying $20 an hour or less, and only 22% of working age adults in Whatcom County were working full-time salaried jobs. Final couple of slides here. We know too that we rely on ALICE to keep our economy running. They are performing duties that are supporting other jobs that are helping our families and individuals in Whatcom County. So we call these folks the maintainers, and we know that in the state of Washington, a majority of the folks who are working in these jobs, those blue dots on that pyramid, are earning less than $20 an hour. We also know, please keep in mind that this data is pre-COVID, that because of the impact of COVID, we're seeing ALICE families and folks in poverty disproportionately affected by the economic impact of COVID. So families with children that are learning remotely, college students that are also learning remotely and maybe not able to be in their college town working. Seniors have clearly been impacted both at home and in facilities, not just with the risk of their health, but potentially seeing their savings dwindling. Folks who are deemed non-essential workers could be facing job insecurity. And then those folks who've been deemed essential workers are often exposed to COVID or are at high risk because they're at their jobs and they're often low wage earners as well. So there are a number of benefits to having sufficient income. When folks can afford the most basic needs, as Kristi said, they can then build on that. Start a savings, plan for the future. And we know that there are some short and long-term solutions as well for our community. I don't know if Kristi wants to tackle this slide.
Sure, yeah.
Right.
I want to be cognizant of time too, but you know, there are long-term solutions. They're often not easy, or we would have made all of these changes and everything would be great, right? But we've got things like public policy changes, higher wages, employee advocacy, unions, family-friendly work and childcare policies. Healthcare is a big issue that gets a lot of airtime. People are talking about. But you know, businesses can help with job share, flexible hours. You know, there's a whole list. I won't just read through it for you, but businesses can do their part to make working easy for families. And I think that that has been something that has happened in light of COVID. A lot of businesses have been rethinking what flexibility means, what childcare is, how families are struggling with their kids at home. So all of these issues are rising to the top, which is great. There's a lot of momentum right now behind childcare in our community, with a lot of organizations really trying to take a big look at what things can change to help children and families. So that's good. We've got, access to the internet. We're seeing that the digital divide is huge, and it's affecting obviously some populations more than others. So if we can find a way to address, internet deserts, food deserts, things like that, so that our resources are spread out to help people who need them, everyone who needs them, not just some people where it's convenient and where they have access to things. Government actions, of course, relief packages, stimulus packages, unemployment, moratoriums on evictions, all of those things were extremely helpful in the beginning, in the spring, and we're hoping that those things can continue as long as COVID continues. Housing, obviously, there's a need for affordable housing. There's all kinds of work we can do around housing, and there's so many organizations in our community who are already doing amazing work. So community support, relief funds, and support for all the organizations that are out there until we can build these big, complicated, giant public policy solutions. We have to support those organizations who are out there every day helping people who desperately need a hand. And so that is why we are always out this time of year talking with everyone and raising funds. We want to raise as much as we possibly can to support this entire network. We're so lucky in Whatcom County. We have so many nonprofits who work together, collaborate, share resources, share clients, and really wrap around services for everyone who lives in Whatcom County. So that's our part. We're jumping in. We want to raise funds. We want to give big, giant grants to all of these amazing organizations. Every time I hear from one of them, I want to give them money. I fall in love with them. So I love what I do. I think everyone at United Way just is really thankful to be here in Whatcom County and to be able to partner with so many nonprofits and so many other great organizations. People like you who are interested in helping in every way they can and educating yourself about our community issues. I think that's step one. So again, thank you for having us here today, letting us share this information with you. I think Patty mentioned there is a website too where you can get more Alice information. If you want to really dig into those charts and numbers and graphs in different counties, you can do that. And if you have any other questions, we're always happy to answer them either online or offline. Just let us know.
Gary, do we have a few minutes for questions or not? Yep, okay. Go ahead. Questions?
Gary, this is John Dunn. I do have a question.
Go ahead.
Turn my video on here. Krista, thank you very much for a really nice overview of all the things that United Way does. I do have one question though. Planned Parenthood, provides a lot of health care to low income and impoverished women. But it's been a policy for a number of years now for United Way to exclude Planned Parenthood. And I wonder if you could comment on that.
Sure. I would love to comment on that. I would like to clear that up, actually. We don't have a policy excluding Planned Parenthood. They have not applied for funding. For many years, we were a closed network, I will say. So we had a group of partner agencies and we every year raised money for the same agencies. Several years ago, we opened it up and any agency can apply for any funding for the programs that fit within those basic needs, economic mobility, and breaking the cycle of poverty. So Planned Parenthood, I don't know if they've applied every year or not, but it's a really competitive process. There's a lot of amazing nonprofits. And so every year we take a look at which programs rise to the top, and those are the ones that we end up funding. And we do that through the help of community volunteers. So community volunteers serve as panelists, and we run all of the applications by them, and they are the ones who help us make the decisions about who to fund. So it's really community driven. So I would suggest, spreading the word, getting involved. If you want to see the list change a little bit from year to year, advocating always helps.
Okay, thank you, Alice. I appreciate the clarification.
Any other last second questions?
I guess maybe I'll ask, I really liked, Kristi, the last slide that you had were all of these different options that things that we can do if we want to take action. If you think of groups like Rotaries in this community, and you could point us in a particular direction towards one of those areas. Is it in the area of advocacy at the state level for policy changes? Is it working with certain parts of your partnership, or where would you kind of point us to make the biggest difference as an organization?
That's a really good question. I will invite Patty to chime in too if she has brilliant ideas. I think you already do a lot for the community. I look at your goal that you're working on for the Max Higby Center. That's huge. But I think of businesses when I think of Rotary, and I don't know if that's correct or not, but I think maybe the advocacy on the business end for employee advocacy, child-friendly, family-friendly policies, higher wages. I mean, we talk about the wages component of the ALICE population and how folks are doing important work. They're essential workers, right? We've learned our essential workers are not necessarily making enough to pay the bills. And so at some point we have to look to companies too to say, you know, what are you paying and how are you determining that? And, you know, looking at the local data, what does it cost to live in the area and what are your employees making? Patty, do you have anything to add on that? Or?
Yeah, I mean, the only other thing I would add is, you know, so many folks are used to talking about the federal poverty level, but it's such an out of date metric that service providers, social and health service agencies use multiples of the federal poverty level when it comes to who can seek services and what that benefits cliff is. So they'll say, if you're at 200% of the federal poverty level or below, you can obtain this service. And it's, you know, and that's why that chart that shows those, you know, those three different funded or the budgets for the three groups and then federal poverty level, it makes sense why they're doing 200% or 175%. Because the cost of living has far outpaced wages and the federal poverty level is really just an outdated, obscure metric. So if you can, you know, promote the idea that either the FPL has to change or use the ALICE threshold as that new threshold from which, you know, people can determine the benefits that folks can have access to. I think that would be helpful as well.
Great, thank you.
Okay, I'd like to thank our speakers. How about a big Rotary round of applause for our speakers? Thank you both. Before I get to just a really brief COVID report, I want to thank all the people that made this meeting possible. Sandy for making everything Rotary possible. Shauna for being our AV person today. Steve Bann, our Tatler reporter. Catherine, our editor for the Tatler. Dick Tucker was our Minister of Fun. You'll get your announcement about how to send money to Sandy here briefly. Music was Rick Kaiser, our invocation Debbie All. Our program was brought to you by our program chairman, Paul Gray. Thanks to Robin for her book review on Magic Lessons by Alice Hoffman, and anybody that I missed. Just a quick thing on COVID. If you've been looking at the dashboard over the last 2 days, the data in it at the moment is completely unreliable. They are doing some sort of reevaluation of the data, and we showed something like a 40% positive test result percentage, and that's not true. The bottom line is that I spoke at the hospital this morning, and we're pretty much still on the same trajectory that we've been. Our positive test numbers are dropping down again, but not to the pre-Thanksgiving levels yet. Patients in the hospital are being discharged, and the number in the hospital has dropped from a peak of 16 a week or 10 days ago. And I don't remember the exact number at the moment, but it's well under 10. And they're reevaluating the number of deaths, looking, I hope, to change it to a more rational system where the cause of death would be actually COVID as a cause, not as a comorbidity. And that data has not yet been released. And that's pretty much what I have to tell you. The vaccine started shipping yesterday. We may have vaccine in Washington as early as tomorrow. I know that the health department is coming forward with some sort of a prioritization schedule that will have first line healthcare people and nursing home patients in the group that will receive vaccine first. But the details of that, to my knowledge, have not been released unless they were released this morning. So that's it in a nutshell. And unless there are questions, I can turn it back to you all or bring the meeting to a close.
Gary, this is Jack Westford. Say, have you noticed on TV at all? I've seen 2 programs where communities have tested the sewage, down the sewer to see how much COVID is possibly in the area. I know it sounds crazy. I see Catherine just going crazy. But anyway, have you heard of that or seen of that?
Yeah, I've heard of it, but I'm not familiar enough with it to comment. And I don't know what it would mean. To my knowledge, there's no fecal transmission. So what that would be looking at is, is there shedding and what does it mean? I'll pass.
Well, what it said on this TV area that I saw, that when they did this, the area went way up on a map ahead of time, and the city was low, but in 2 weeks it came up to that same area. It's just a possibility.
Very good. Thanks, Jack. Anyone else? Okay, I'll go ahead and bring the meeting to a close. Rotarians, thank you for all you do in the community. I look forward to seeing you next week. We had 50-something participants today. Not quite as high as last week, but still solid. Invite people that you're not seeing to join us, maybe even help folks along and make sure we touch our members who are not participating. See you all next week. Thanks.